Let's move on to something that's bothering us right now. We're having to do, right? It has to do with COVID-19. We're seeing the numbers surging. Yesterday, the figure that we had for July 29th, I believe, we were looking at almost 6,000 active cases. And it's become clear that the Delta variant is on rampage. What is it that Parliament can do to support the movement to get people to adhere to the protocols? Because this has been a challenge. You go out there, you see people not wearing face masks, and they're going about their business as usual. A lot of them say they're fatigued, they're tired, and some of them too say, we actually don't believe that there's COVID because of the actions of our leaders. What is it that we can do? Doc, you're...
Okay, let me first say that the problem now we have in Ghana is that somewhere along the line, it appears a leadership, or should I narrow it down to possibly political leadership, relaxed in their own advocacy for people to wear masks. It appears that we have lost our moral high ground to preach about observing the protocol, and that is because of what happened. We went for election after that. Later on, these funerals that involve practically people not obeying the protocol.
Mass gatherings, demonstrations, weddings,
etc. that has taken place. And the people seems to say that you political leadership, when it is convenient for you, you don't observe the protocol. When it is convenient for you, you call people together and you don't observe the social distancing. And when later on, when you want, you can now tell us that we should go back and wear our masks, we should do this, etc. So it appears that we have lost our moral high ground to preach that. But the situation I want Ghanaians to understand is that, the beta wave or whatever wave, the second wave has passed. More people were killed than even the first wave that we all observed the distance very well. Now we have a Delta wave, that is supposed to be much more virulent than the first and second wave. And yet, it appears that we are not ready to observe the protocol. So we have to appeal to the people that, just like one priest said, don't observe what I'm doing, you listen to what we are saying. I don't know, it was in Tree. I'm only trying to interpret it. No, from Bobra, Team America. Meanwhile, he was a drunkard. Yes, but he was a priest. So he said people shouldn't look at his lifestyle, but what he's saying. So I'll also seize this opportunity to tell people that don't look at we the leadership, but do what we tell you to do. Having said this country has delayed in its rollout of vaccines. That is the major problem that we are facing. In developed countries now, even though the Delta wave is on, they have observed that the number of people who are dying from it is reducing.
Yeah.
Those who are getting very serious, or those who are getting severely ill, that one too is reducing. And that is because they've taken their vaccines. If it's a double vaccine, they've taken that, a complete one. So when even they fall sick, it is a mild one. So in Ghana here, our major problem is that there has been a delay in the rollout of our vaccine program. And as we speak now, the government cannot even get some to buy at the open market.
And that's the challenge. The government says that, we have the money, we want to buy, but it's not available.
But we have to increase our diplomacy. The first batch that came, the COVAX facility. Ghana was the first country in sub-Saharan Africa to receive their own. As we speak now, yesterday, I think I read somewhere else. Nigeria have received another 4 million doses.
Well, we've been told that we're also going to get ours.
But
the first one that came Ghana got it first.
Why can't
so another country will get a second.
No. Why don't we remain first?
No.
We have to work hard.
We can't have it first all the time, especially if it's a gift.
Some of them have not even gotten any.
Yeah. No. Don't let us always go and comparing ourselves with Chad and whatever countries that you have. Tanzania. Let us always be with the best. And when you were in school, is that not what you were always trying to do? We always wanted to be with the best.
Oh, being the best is...
Being the best or with the best.
Being the best or being with the best.
The minimum this thing was to be with the best.
That way before now would have put in some money or made it clear that we're interested in getting the vaccines.
That's what I'm saying that,
the ship has sailed. We lost the opportunity. And now we're looking for the vaccines, we have the money, but we can't.
That is the major problem now we are facing. But having said this, I think that, half a loaf is better than none, and we still have to be with our old and tested protocols. Until such a time that
wearing of the mask, washing your hands, social
distancing, etc. Until such a time that the vaccines do arrive.
Vincent, do you get that pushback when you go to your constituency and you're trying to get the people, wear your mask, and then they'll tell you that, I'm told they'll tell you in Cranford area, a craft for area.
But Israel, do you know that there are people still in this country who don't believe that COVID exists?
Oh yes, I know.
The terminology that they give to it is a foreign sickness.
Yeah.
For those of us in Accra, things that is for those abroad. For those of us also in the villages, think that it is for the people in Accra and Kumasi. That is the kind of philosophy some of our people are having. And I think that the president couldn't have put it better when he said that we've let off our guard. When COVID-19 started, a lot of the Ghanaian people, and I think that it is because of how leadership also took it serious. A lot of people were using the protocols very well. People were using their nose masks very well. You moved to Makola at a time when lockdown was over, people were using their nose masks. People were ensuring the distance in the 1 meter distancing. People were using sanitizers and what have you. But today, as we speak, we do not see that. And people do not even regard that the COVID is existing. Go to places whereby they admit COVID patients. There you will see that COVID is real. Today, go to International Maritime Hospital. Yeah. It's full.
There are many who say that I don't know anybody who's had COVID. I haven't seen anybody, or I don't know anybody who's died.
I know a lot of friends who had COVID. A lot of friends. You remember my own boss, Dr. Matthew Poku Prempe, and a close number of people who were very close to him. Because at the time, I was in the constituency campaigning. So I would say I did not have the opportunity, to put it lightly, to be infected with COVID. But everybody was around Dr. Matopoku Pepe at the time had COVID. I know of very good friends that I don't have to mention their names on there. But people who nearly lost their lives very close to me because of COVID. Yeah. Yet people disregard the impact and the severity of COVID-19 because they feel that it is foreign sickness and what have you. We need to use big platforms like these to communicate to the Ghanaian people that COVID-19 is real. You move to places where patients of COVID-19 are, you realize that the places are full. Just about last 2 weeks, I heard the Ashanti Regional Director of the Ghana Health Service claiming that the number of people who have been infected with COVID-19 is increasingly increasing to the extent that they fear that if that is the kind of rate that people are going to be infected with the COVID, especially with the inflation of the Delta variant. Then it means that the capacity to which they will be able to hold up the situation will not be there anymore, because you cannot just say that there's a 100-bed facility for COVID-19 and that will mean that it will be able to admit 100 people. No, the facility will be there, but the human capacity to be able to deal with 100 people is not there. And at the point in time, they will tell you that even though it is 100 capacity COVID-19 facility, but it can take maybe 25 or 30. Yeah. So what it means is that everybody will have to be careful, and everybody will have to make sure that the protocols are being adhered to. The President of the Republic have already cautioned that if we do not follow the protocols very well, it is possible that there can be a second lockdown. But what is the impact of a second lockdown? The impact is that there will not be any economic activity, and that economic activity that we are going to lose will mean that no flows of revenue. The Minister of Finance have already come to Parliament to project the revenues that we can get within a year. In the absence of that revenue, what it means is that expenditures will not be met, and we need to also get monies to be able to do other things. So the impact is going to be dire. Okay. And we have already moved from an era whereby our economic growth was about 6.7 in 2019, and now it has dwindled to about 2 point something or 3 point something, sending us back to the days of 2012 when the NDC was in government. And so that is not the kind of things that we want to see, because...
You had to mention the NDC. But how about enforcement? Because we're talking about advocacy, trying to encourage people to wear their masks. But we have laws that require that we enforce these things.
You remember there was an executive instrument that was triggered by His Excellency the President, Nana Akufo-Addo, with respect to protocols that are supposed to be adhered by the Ghanaian people, and failure to adhere to those protocols will be tantamount to certain sanctions. Unfortunately, around this table, we all agree that enforcement has been a problem or has been a challenge. But when I listened to His Excellency the President the last time, that was on his 25th or 26th engagement with the Ghanaian people with respect to COVID-19, he was very clear and succinct about the fact that he is now going to ensure that there is that enforcement, and he has charged the Ghana Police Service, which is clothed with the legal responsibility to enforce these laws. So when you are seen walking around without a nose mask, our laws are very clear about it, that you can't be arrested, and the punitive sanctions that are there for you should be enforced. So the new IGP, Dr. Dampare, I know that you are very young in office, just about a week, not even a week, it was sworn in just last Friday, so just about 3 or 4 days. I will urge you, Dr. Dampare, I know you are a man of your words, and I know that you have very good convictions to change the image of the Ghana Police Service. I'm hoping that the President's directive of enforcement would be dealt with, so that the Ghanaian people will know that indeed COVID-19 is not a foreign sickness.
Dr. Nawaane, would you suggest can we look at the punishment regime or the sanctions regime again and probably make them less punitive? That way we can enforce them, because some of the fines that were introduced at the time, the consideration was that they were too high and really they were not feasible.
Yeah, we can make the laws or the regulations and bylaws, etc. that we want, but its implementation has been a problem. And I remember that some people were arrested for no social distancing, and they were all kept in a pickup, you know, and it became the talk of
it's
defeat the purpose.
Yeah, we could also decide to, as done elsewhere, we could decide to send them to stadiums and keep them there, let them sit there for a while.
You know, so possibly if I don't know whether fines or something, some mild fines or something could do. You know, say that whenever you are fined about 2 or 3 times a day, you know that yes, you've got to stop it, because
you're detained at the stadium for some hours.
Yes, but having said that, I believe that, you know, as a country, we need to plan very well. I don't know whether we thought that the COVID was a one-touch issue. Because our COVID expenditure is so overblown. I mean, 19 billion, they call this figure. And they want to attribute everything to COVID, even though some of us believe that it was because of the election year.
Okay, is that
do,
the
do you
argument
get
you
me?
want to make?
So we should, no.
Is
But
that
you
the
went to
argument you want to
2012. Are we in 2012? You
So we
went
should
to
allow the
2012.
Ghanaian people to die. That's what you're saying.
No, I'm saying that 2012. I mean, I'm saying that
if it's expensive,
the
let's try that.
no.
Is that you mentioned?
I'm talking of.
2012, so you also mentioned.
I'm talking of the expenditure.
If COVID is
Expenditure,
expensive,
yes.
let's allow people to die. That's what you're saying.
No. I mean, it's too much. It's quite on the high side.
Really?
Even though we
So
believe
people should die?
that probably because it was an election year, because you can't account for this monies that was used left and right, and then So we should actually.
Is it the case that it can't be accounted?
No.
You are in parliament.
Yeah, the
Every
minister
money
of
that
health
is
came
spent-
and said that I can only account for 600 million Ghana cedis. He came and said I can only account for
budget
600
doesn't sit.
Yes,
Just saying.
with the minister of health. Very good. And up to now, as we speak, nobody is ready to put all the departments together and arrive at the 19 billion.
Bring them
Do
together.
you know that nose
Bring them
mask?
to
Do you know
Parliament.
that
We
nose
have
mask
brought
were
them
procured
to
for all
Parliament.
students in this country? Do you know that?
Oh, you stop.
And do you know that was done by the Minister of Trade or the Ministry of Trade?
Yes.
So if you make this
it is the
argument,
work of the ministry,
that's not
the
fair.
ministries to now act together and account for this gargantuan money
oh,
that
You have the
we
power
demand.
to
So
stop
let
that.
us
ask a question. in Parliament.
I mean, how many questions haven't we asked? So let us make sure that we plan for a long-term management of COVID. Because if you look at the COVID fund, it got to 56 million. And the last time I think that they gave us a brief on it, it was left with 7 million in it. And now we are projecting that there's going to be a third wave, which might be much more severe than the first and second. Yeah. And look at the amount of money that we have, sitting down. We are now on a third wave. About 900 million or so Ghana cedis have been budgeted for the COVID. During the media review, the minister said they had released 126 million, for the purpose. And we can't, the rest of the money is not yet available. And as we even speak, there's a $16 million that they say they used to pay for Sputnik vaccine. And one ministry, that is the Ministry of Finance, is saying that during his media review, it was there. And the Minister of Health is also claiming that no payment has been made for any Sputnik. So, and you ask these questions, and sometimes you think that you are just going to get answers by the next day or 2 days, and it continues like that. I mean, hanging for people to speculate, or for us, or if you want, go and speculate.
Yeah.
But the answers are not coming.
Eventually, you should get them to Parliament to get to do that, to get to answer all the questions that you have.
Yeah, well, that is true, but some of these things could have easily been answered if, I've paid for it, I've not paid for it. Can't this thing be resolved within 24 hours, 48 hours? Yeah. And, look at this UTAC issue. For about 3 weeks or so now, these people have been advertised, we will go on strike, we will go on strike, we will go on strike. And we sit down until they go on strike.
Yeah.
Before we call
Vincent,
them.
why would
Before
we
we call them.
sat down and they made it clear that that's what they were going to do.
It happened that they were
This
not
thing has been dragging for
dragging.
But you see,
I'm not saying that nobody. I've got my daughter
Doc,
too at the university there.
Doc.
So affected.
Yes, also affected.
Doc.
So I'm not happy that
You and I,
UTAC.
Doc, you and I are in Parliament.
You
We understand that there are rules that are supposed to be followed before you can declare a strike in this country. Failure to exhaust those rules and regulations will mean that the strike that you've declared is illegal. I am happy.
Well, yesterday, the National Labour Commission didn't declare their strike illegal.
I'm not saying so, but they also mentioned that they were still at the negotiation table. To my estimation, If you are still at the negotiation table and you need to exhaust the opportunities that are available to you, why do you declare a strike? I am also not in any way saying that the strike that has been declared by UTAC is unconscionable or is unreasonable. If you listen to them very well, yes, there are bases for it. There are some conditions of service that they are supposed to be getting from the government, but it does not also allow for certain untruths to be peddled, especially when you say that professors are not even paid up to 5,000 Ghana cedis. That cannot be true, because you know that a single spine salary structure puts a professor at level 25. And level 25 for the single spine salary structure is about 74,000 Ghana cedis and over. If you do the simple calculation by dividing 74,000 by 12, it will tell you that a professor at the level, that is even for step 1, at the level of 25, level 25, is not getting less than 6,200 cedis a month. So, I mean, I am not happy with how we have to be throwing some of these issues out to the public, especially when we know that there are better ways of dealing with this matter.
But you see, we tend to let these things drag for so long.
Agreed.
Then something happens.
Agreed.
And then they decide to embark on a strike.
But do you know the biggest problem of that? Or do you know the biggest trigger of that? When we are going to the negotiation table, you don't go with an entrenched position. Government will say, this is my opinion. We, the stakeholders, or we, the UTAC people who are also...
We can't say that for the case of UTAC, as far as I'm concerned, because this is a conversation they've been having for a while. It appears government actually, empathizes with their position.
Let me cite an example for you. CK Tadem in Navrongo. You know that it was just made a full-fledged university out of UDS. And do you know that because they are now a full-fledged university, they are supposed to be migrated on the single spine salary or the IPPD2. What it means is that hitherto, they were being paid from UDS, but now the migration will have to happen. They are now resisting the migration because they feel that they will be worse off. Because UDS, when they pay them, is a better remuneration that they get as to the migration. What it means is that now you are resisting the migration, so guess who is going to pay you? They're not going to be paid.
It still comes back to the UTAC. I'm saying the UTAC case is quite clear.
Yes.
They have made it clear that, look, in fact, we are not actually asking for more money.
Right.
We're looking for a restoration
right.
where we used to be.
Right.
And they say they've been having the conversations with government for a while, and except they don't think that government is that committed to making sure things happen. And they've been talking about this for so long until they had to embark.
Israel, you cannot take that away from them. You cannot take that away from UTAC. Why? I was the PRO to the Ministry of Education, so I know about all these happenings. At the time that they started with this engagement with NLC, I am fully aware. You cannot take it away from the UTAC people. In fact, they are right in claiming. They are right in claiming the conditions of service that is due them. But I'm saying, the impact of COVID in 2020, that for the first time in the history and annals of this country, our students have to be learning online. For the first time in the history and annals of this country, our calendar in the various universities have been distorted because of the impact of COVID. The National Union of Ghana Student Secretary couldn't have put it better when he said that. They are pleading with UTAC, especially considering the situation that they find themselves. That if a final year student has lost almost a year because of the impact of COVID, because now the calendar has been distorted, yet UTAC is now claiming that they deserve certain kind of condition of service, which I agree, but with the time that we find ourselves in, can we be a bit humanistic, a bit understanding to the number of students out there in our various universities, KNUST, University of Ghana, who have to go through this difficulty of not being allowed to write their exams because UTAC is on strike. Yes, it is right that you ask for what you deserve, but the times that we are in, I ask this big question, UTAC, considering our children and considering our brothers and sisters that they find themselves in the various universities, do we have to punish them this way? Especially when there's a pandemic that you and I and all of us did not anticipate that there's going to be this COVID-19, and the impact is dying, and the impact has had a toll on our educational system. Do we need to add this upon the child or upon the students in KNUST University of Ghana? It is by no fault of theirs that COVID happened. So I'm pleading with them, Israel.
Yeah, we are pleading,
that UTAC should reconsider their decision. On Thursday, as the NLC has called them to come back to the negotiation table, they should avail themselves and ensure that we end this matter amicably.
Okay. Israel, we are all pleading, you see, but there's no need to shed tears for this government, and so far as some of these issues are concerned.
Why?
Within these 6 months, they've borrowed about 43 billion, and everything has gone into goods and services and compensation. And so everybody knows that, yes, they are not interested in borrowing for infrastructure.
You know, we'd have to wrap up the conversation.
Yes.
But I want to end with this. I've been talking about the fact that the Ghana Medical Association is also warning. So they're talking about the non-implementation of conditions of service for medical doctors and dentists working with the Ministry of Health and its agents, September 2021, failure to which the following roadmap will kickstart. Outpatient services to be suspended for a week, effective Friday, 1st October 2021. Withdrawal of all inpatient services will begin the following week, effective Friday, 8th October 2021, if all the issues are still not completely resolved. The next week, beginning 15th October, will see a complete withdrawal of all services. They've issued this warning, and I'm hoping that the authorities will take it up and deal with it so that we don't have another strike on our hands. But thank you very much, both for coming.
Good call. That's a good call.
Yeah, Vincent Asefa, Tafo MP, and Dr. Mark Nawaane, who's the NABDAM MP. We're watching AM show. We have more coming your way. We'll be discussing Fix the Country. The group is to hit the streets on August 4. That's tomorrow. We'll be having a conversation with them. Do stay tuned in. There's more coming up on the AM show.